Hello viewers and welcome to MedGate Today TV Digital. And today we are at 7th edition of Thought Leadership Summit, an initiative by HOSMAC. And with us we have Dr. Sunil Chandy. He is the Chief Medical Officer at ITC India. And he had the panel discussion as a fireside chat, can CSR and NGOs move the needle in healthcare delivery? So let's talk about what kind of topic is this and what kind of conversation he had with the other panelists over there and how he sees that CSR and NGOs can lead and be the needle in the healthcare delivery. Hello, sir, and thank you for coming here.
Thank you. So, to the question that you asked, today healthcare is dominated by private healthcare, which has brought in a lot of quality and a lot of upgradation of standards of care in India. But it actually caters to a very limited percentage of the entire population.
Okay.
So if you look at the needs at the ground level, which includes the rural landscape,
Yes.
tier 3, tier 4, even tier 2 cities, the private healthcare system is not grown enough. They are trying to get into tier 2, tier 3 and tier 4 as well. But because of the disparity or dichotomy between the needs of the rural space and the urban cities, metros, I believe that in order to transform healthcare, I'm talking about public health, it is necessary that CSR allocations be made bigger.
Yeah.
In this space, not just the NGOs, but the government and even the corporates can play a role.
Yeah.
Because it's actually like widening the net onto the areas where healthcare is really a challenge.
Yeah.
But these are the people who are downtrodden, displaced, disadvantaged, have no money, have no health awareness.
Yes.
So the answer is yes. And it's very urgent that CSR from big companies, small companies, NGOs, the government, even the corporates put aside some allocations to enhance the stake of healthcare in India.
Okay. So you have put one word, government initiatives. So sir, if you have to give the suggestion to the government to bring the CSRs and NGOs more prominent in delivering the healthcare, so what kind of initiatives does the government should take?
Well, actually, the present government is doing quite a lot. We have Ayushman Bharat in its original form, the PMJY, the Digital Health Mission, ABA, all these have together made an enormous amount of difference already. I think it is the government's role should be to press on and to prioritize the CSR allocation. By the way, CSR is not just for healthcare, it can go into agri, it can go into the social space, education. But I'm submitting that healthcare should be given number one priority for CSR allocations. Because healthcare is the crisis. Healthcare is where the maximum. Now remember that this has got an economical benefit as well. Because a healthy Indian, a healthy person is a productive person. Socially productive, intellectually productive. And healthcare is not doing as well as it should because of in the public health space. If you look at all the diseases that you can think of, diabetes, hypertension, heart disease, sudden cardiac death, cancers, lung problems, they are all exponentially increasing. So it's in that space where a lot of money has to be put in. And therefore the government must nudge companies and NGOs, whoever, to put in more money and interest and commitment to healthcare.
So we should force more capitals as a catalyst to bring the best delivery in healthcare for our nation. And sir, if I talk about this summit, we have, you can say, brainstorming topics, and the one which you had was more tremendous out of all. So how you're finding this summit and what would you like to, you can say, summarize this summit? And
honestly, this is one of those summits which has been in such a short time, just over 6 to 7 hours, has maximized the inputs that are today very crucial. We've talked about capital, we've talked about operations, we've talked about mergers and acquisitions. Now, these are all things that are happening today in India. and in fact maybe leading the world, in terms of how healthcare can be enhanced.
Yes.
It has also talked, like in this session, we've talked about CSR, NGOs and all that. So it was a very comprehensive conference where all aspects of the healthcare prospectively, we are not talking about the past. How do we position healthcare? How do we project healthcare, take it into a different trajectory which will benefit the entire nation, is the takeaway message from this conference.
Thank you so much, sir, for giving such a wonderful brainstorming thoughts from your side, and I hope that the government and the people who are listening to us will give the best out of those thoughts, and we hope that in the future we will be seeing a lot of good initiatives, not only by the government but also by the public sector as well. Thank you so much, sir.